My name is Alex Levine. I'm a graduate student at the University of Wisconsin-La Crosse in the Adapted Physical Education Teacher Preparation Program. The purpose of this video is to demonstrate effective techniques for teaching object control skills like throwing or catching to young children with Down syndrome. The video will also cover behavior management techniques to help become proactive rather than reactive when dealing with behavior issues that are fairly common in this population. The target audiences for this video include general and adapted physical education teachers, parents, paraprofessionals, physical therapists, occupational therapists, and any person seeking to better understand how to teach object control skills to children with Down syndrome. Gross motor development, including object control skills like kicking, striking with an implement, catching, throwing, dribbling, and rolling, are vital for children to acquire during the early years of childhood. Developing competency in these skills provides children with the confidence and ability to apply them when playing games with friends, outside at recess, and on youth sports teams. As participation in physical activity increases, socialization with other children fosters the development of basic interaction skills that are necessary throughout life. Gross motor skills are the building blocks for additional physical activity and lead to the maintenance of a healthy and active lifestyle. They provide children with skills that open doors for opportunities to participate in physical activity for a lifetime and lead to benefits in physical and mental health, social interaction, and quality of life.
While gross motor development is vital for all children, research along with trends in this population have shown that it may be even more paramount for individuals with Down syndrome. Barr and Shields explain that 58% of children with Down syndrome do not meet the recommended 60 minutes of moderate to vigorous physical activity every day. Dodd and his colleagues stated that many adults with Down syndrome do not participate in the recommended levels of physical activity per week and are typically sedentary. While obesity and secondary health concerns are common among this population, the opportunity to take control of these issues is presented in the early stages of childhood. Increasing physical activity levels and preparing individuals with Down syndrome to meet these recommendations begins first and foremost with the development of gross motor skills, specifically object control skills. With adequate gross motor development in the early stages of childhood, individuals with Down syndrome can hopefully increase their physical activity levels and be active throughout life. Additionally, opportunities for participation in adapted sports leagues, recreational physical activity, social interaction, family quality time, weight management, and physical enjoyment can be made possible.
Now that we more clearly understand the importance of gross motor development in children with Down syndrome, specifically object control skills, let us get a better idea of Down syndrome.
Down syndrome is a genetic condition that occurs in 1 of every 691 births, making it the most frequently occurring chromosomal abnormality. The most common form of Down syndrome is trisomy 21, which occurs when there are 3 instead of 2 number 21 chromosomes in every cell of the body. That extra genetic material alters the course of development and causes the characteristics associated with Down syndrome.
The common characteristics in individuals with Down syndrome, like joint laxity, hypotonia, delayed speech, vision and hearing issues, and poor reflexes, have both health and cognitive implications that play a role in the acquisition of gross motor skills. In his research, Payne and his colleagues suggested that children with Down syndrome have the ability to achieve the same motor levels as typically developing children when the appropriate intervention is provided. Keeping in mind the implications of certain characteristics often accompanied by this condition and utilizing strategies for effective instruction, children with Down syndrome can develop functional gross motor skills that result in meaningful participation in physical activity. This will ultimately equip them with a set of fundamental gross motor skills for physical activity, recreation, leisure, and enjoyment later in life. Let's listen to what some of the professionals in the field, including adapted physical education teachers and physical therapists, had to say about what they find to be the most difficult and prevalent challenges when teaching object control skills to children with Down syndrome and the importance of these skills to physical activity and health.
How do hypotonia and ligamentous laxity affect the manner in which children with Down syndrome develop object control skills?
Well, hypotonia is a decrease in stiffness of the muscle, and it makes it difficult for children with Down syndrome to do skills that require strength and power.
Both of these conditions present different challenges for students, including lowered muscle tone or high degree of flexibility within those muscles that present challenges for the students when they begin learning and acquiring skills. So for example, if a student had lower tone in their legs, you may have to spend additional time working on things like balance and coordination in order for that student to have a more refined walking pattern.
What are the most common object control skills that are delayed in development in children with Down syndrome?
Common object control skills that are delayed in children with Down syndrome are skills that require balance, rhythm, and timing. So for example,
dribbling is very hard. The muscles in the hand have hypotonia, so they're relaxed. It's hard for, and the wrist, it's hard for the students to dribble a ball and keep their hand and wrist stable to dribble.
How do these delays pose challenges when teaching object control skills to young children with Down syndrome?
Children need to have both coordination and balance to perform object control skills. So,
a lower muscle tone, you're going to have to work to develop those muscles in order for the student to perform those skills. Along with that, things like dribbling, catching, or throwing require a student to grade force with their movements, so you'll need to develop muscle tone in those students prior to them being able to successfully complete those skills.
Now that we've heard what some of the professionals in the field have to say about the implications of certain health issues, motor delays, and behavioral issues in children with Down syndrome, let's take a look at how we can effectively address them when teaching object control skills. Research and teaching literature on the development of gross motor skills in children with Down syndrome suggests certain instructional strategies can help foster learning by carefully planning and differentiating instruction for children with Down syndrome.
Allow extra time to complete tasks. Provide adequate time for practice. Utilize the task analysis method of teaching. Break down instruction into as few steps as possible. Modify the equipment and the environment. Utilize visual and tactile supports to aid in the instruction of the skill. Set the child up for success by implementing developmentally appropriate motor tasks. Utilize peer interaction and mentors to maximize effort. Practice to a point where the child's performance begins to decline or they lose interest. Treat the practice or instruction as a game.
The following are examples of how these instructional strategies might be implemented in general or adapted physical education, working one-on-one or in a group setting with a child with Down syndrome, and how to ensure effectiveness when using them. Since children with Down syndrome often have delayed or slow reaction times, it's important to allow extra time for the child to respond to verbal and visual prompts and instructions. Not waiting long enough and stepping in may cause the child to learn to rely on your support instead of initiating a movement or task themselves. So, I have 4 pictures for when we throw. And we're going to read them, and you're going to put them in the order that they go when we throw. All right? Yeah. Can we do that? What does this one say?
Well,
throw.
Step. No, like.
Follow through. Point. So, when we throw, what order do we do those things in? Can you put them in a row? Which one's first?
Step.
Very good. So step is. Without allowing that extra time, the person teaching may jump to the conclusion that the child is incapable or doesn't know how to perform the desired skill or task. Providing adequate practice time is vital for skill acquisition to actually take place. Children with Down syndrome require many more repetitions of a skill before it becomes learned in comparison to typically developing children. This may mean that more time will have to be spent on a skill before moving on to the next one. Setting the student up so that they can practice at home is another very helpful strategy. Sharing with the parents their child's progress and giving them suggestions on how to practice a skill at home will allow for more repetitions and quicker learning. The task analysis approach of teaching consists of breaking specific activities into fundamental components to pinpoint sources of performance difficulties or to facilitate specific instruction.
Ready? Set. Go! Run, 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 run! Woohoo! Good job! Awesome! Nice job.
It is important to structure the task so that the most effective movement solution is the one that you want the child to learn or improve on. Providing lengthy or wordy directions will only confuse and make the child feel incapable of performing the movement. In addition, slang or words that may have multiple meanings should be avoided, as many children with Down syndrome are very literal learners.
Two is two.
Do this 3 times.
One jump.
Step.
Two, maybe.
Swing.
We yellow like
Follow through.
ball. Wait, ball.
Get a new ball. Do you think Directions given to a child should be presented in a few simple steps. This will make it easier for the child to remember what they are being asked to do. Modifying the equipment and the environment may be one of the most important strategies for ensuring the success of learning object control skills. Equipment like balls, bats, tees, goals, nets, and targets can all be modified to increase the chance of success the child experiences. When the child is successful, they'll be more likely to maintain engagement and ultimately learn the skill.
Use this one? Okay, you have to catch it. Okay, show me your hands ready to catch. Catch. Okay. Good try. Do it again. There you go. Yay! Good job.
In addition to modifying equipment, the environment can also be manipulated in many ways to help foster learning. If in a distracting or busy environment, you're going to want to instruct your student from a position so that they are facing the direction where the least is going on. If the child performs better outside, inside, on carpet, on grass, on hardwood, in certain lighting, these can all be manipulated to maximize their engagement.
I'm ready. Good job! Whoa, there we go.
Based on the preference or interest specific to the student, equipment of different textures, sizes, weights, and colors can be used to motivate them and accommodate them. While it is generally more difficult for children with Down syndrome to process verbal instructions, many are visual learners, and utilizing visual and tactile supports to aid in instruction is paramount. Providing visual demonstration of a skill can motivate the child to imitate what they have just seen. So, I have 4 pictures for when we throw. And we're going to read them, and you're going to put them in the order that they go when we throw. All right?
Yeah.
Can we do that? What does this one say?
Wow.
Throw.
Jump.
Step. Depending on the child's preference, visual demonstrations can be presented by the instructor, in a picture, in a video of another person, or in a video of the student themselves. And I'm going to come over to my tee, and I'm going to stand on the purple ones, and I'll show you first, okay? I'm going to step to the orange. Yeah, oh, I'm going to hit the plate too, yeah. All right, so I'm going to step, swing, and I'm going to follow through. And what's my last direction? What's number 4?
New ball.
Get a new ball. Yep. So it's Setting up a child for success is another important strategy for teaching object control skills. Since children with Down syndrome tend to stay motivated when excelling at a task and present avoidance behaviors when they are not, it is important to manipulate the equipment, the environment, and the task so that they can be successful. If a student is learning to throw a ball, they will not experience success if asked to throw a ball that is too big to be held in one hand or at a distance that is much too far. Let's see our step, point, throw. I like your point and your step. Why don't we try this ball? How about this one?
Yes, easy.
And why don't you come up to this one? Good. Nice throw. That was a good one. Remember to point at your target. Good, much closer. Let's do one more. One more. Nice, that was right on. That was a good one. Developmentally appropriate equipment and tasks should be utilized to maximize success. This also means beginning with a task where they will succeed and progressively making the task more difficult as their confidence and skill level increases. Appropriately making adjustments to the equipment or the environment that the child is performing in can make all the difference in maintaining engagement and keeping the child motivated. Similar to most individuals, children with Down syndrome are highly motivated when joined by a peer, a sibling, or just another friend to complete tasks or engage in physical activity with. These individuals can correct skill execution, model correct performances, and relay the importance of skill to the child. When a child is participating in an activity with a non-disabled peer, they can see the importance of learning the skill more clearly. They see that others have already learned this skill that allows them to participate in a certain activity, and this can motivate them to learn that skill also so they can participate in that activity. While the child may occasionally become frustrated or tired of hearing the same person trying to correct or teach a skill, they may respond better to other individuals. Practicing new object control skills should end when the child's performance is no longer at their best. Once the child has hit the point where they are beginning to lose interest or are not giving it their full effort, it is time to move on to a new task or take a break. Some signs that the practice should end are when they appear tired, start performing worse, demonstrate avoidance behaviors, or start to fuss and complain. It is important for the child to associate the skill that is being learned with a happy and fulfilling feeling so that they continue to practice and improve. When they become frustrated or lose interest in the skill that they are learning, they will no longer have a desire to engage in practice to improve that skill. Since motivation is such an important factor when teaching children with Down syndrome, an effective strategy in maintaining motivation is treating the practice or instruction of the skill as a game. If the child you're working with has developed an understanding of points, winning, and scoring goals, utilizing these can be a fun tactic to increase motivation. Right here. All right, and we're gonna go for another 30 seconds. Are you ready? Set, go. Oh, nice throw. All right, go, go, go. Nice, one. Keep going, keep going. Step, point, throw. Nice, two. Keep going, keep going, keep going. 15 seconds. Step, point, throw. Nice. 3.
Do another one.
10 seconds. Nice. Try for one more. Practicing object control skills in a way that allows the child to earn points, beat a score, or win something will motivate them to continue to participate and give their best effort. Let's take a look again at these 10 teaching strategies that can effectively help teach object control skills to children with Down syndrome. The next part of this video will focus on the need to be proactive rather than reactive when teaching children with Down syndrome in order to prevent unwanted behaviors. Additionally, we will introduce you to techniques that will help motivate, instruct, and reward the child you're working with.
What are the most common behavioral challenges you face when teaching object control skills to young children with Down syndrome?
Traditionally, children with Down syndrome have a stubborn side to them. That stubborn side that we see often comes when students don't feel successful performing a movement or don't feel motivated to perform a movement.
So children with Down syndrome can become easily frustrated. Their frustration then is expressed in avoidance behaviors, trying to get out of the task, wandering off, trying to redirect you to tasks that they might enjoy more. They might try to engage you socially by...
What strategies do you use to help prevent or address these behaviors?
Making sure that you give them opportunities for repetitions at different heights, different levels, different speeds.
So reinforcing the positives that a student achieves in movement or behaviorally have been successful ways to overcome that stubbornness or that frustration. And then just working with them to continue to build those skills in a variety of different ways has overcome some of the frustration of acquiring skills.
Providing plenty of repetition to practice the task so that they can learn it and become proficient.
Having a structured classroom environment for those students so they know what to expect going in and what some of the things that you're going to do for the day are. If you have that, then you can start to predict where those challenges may come in, and the student can start to predict where some of those challenges may come in, so you can work together.
In addition to the health concerns that affect gross motor development, behavior management is a key factor when teaching children with Down syndrome. As we heard earlier, some children with Down syndrome have tendencies to be stubborn, oppositional, or present behaviors that make it difficult to manage and structure the learning environment. Since they do require adult supervision, they may become used to that attention and accustomed to receiving it. Once it is not there to the extent that they want, they may protest. Often, a child with Down syndrome is excited and is engaged in a task when they are feeling successful. As soon as they feel unsuccessful, they may become frustrated and unhappy. It is vital to recognize these two extremes and create an environment where the child can be successful, to minimize frustration and to manage challenging behaviors when they do arise. The following strategies can be used when planning, teaching, responding to, rewarding, and handling the behaviors of children with Down syndrome while teaching them object control skills.
Provide structure and establish routines. Utilize picture schedules and visual reminders. Maintain motivation. Use consequences that strengthen the behavior they follow. Use if-then statements. And limit distractions.
Let's take a look at how these behavioral strategies can be put to use in the actual physical education setting while working one-on-one or in a group setting with a student with Down syndrome. Children with Down syndrome commonly respond and perform better when in a structured and familiar environment. Having information about what will happen at the beginning, in the middle, and at the end of each session allows the child to feel comfortable and in control. This is one example of a schedule visual aid that can be used. If you see, there's a to-do side and an all-done side. So the student can see what activity they have next, what they're supposed to be doing now, and they can move that activity to the all-done side once they've completed it. Once they have all of the activities for the day on one side, then they know they're finished. A structured environment should similarly be kept in mind when teaching new object control skills. This does not necessarily mean that the activities are going to be exactly the same each time, because that would be boring and the child will most likely lose interest. However, creativity and variety should be a focus so that the child is always engaged, but structure and routine can provide a format for the flow of that session. Having a set routine and introducing components of a skill in a strategic manner can help promote the appropriate behaviors. An established routine should include a system for alerting the child when it's time to clean up or to transition. A method for reminding the child when cleanup will give them the appropriate time to prepare to stop whatever it is they are doing. Here are some examples of how you can visually represent the amount of time left before cleanup or transitions to a student. You could use time cards. So when there are 10 minutes left, show this card. When there are 4 minutes left, show this card. And when there's 1 minute left till cleanup or transition, you can show this card. If you hang them up on a wall, the child will always know how much time they have left. Another example could be using something like this. At the beginning of an activity, you have the child do 6 repetitions. Once they finish one, they take off 1 soccer ball and put it in a separate area. When they're done with 2, they take off the second, and so on. Once all 6 soccer balls are gone, then it's time to clean up or transition. Letting them know when transitions or closures are approaching can help avoid undesired behaviors if they don't want to stop the activity. A cue can also alert a child that stopping point is in the near future if they do not want to keep going. Many students with and without disabilities benefit from the use of visual aids, and children with Down syndrome are no exception. Whether it be a picture schedule, cue cards, video demonstrations, or visual representations of time or scores, children are able to process what is being asked of them in an alternative way. Visual materials can present information to children in a way that they more clearly understand. While it takes longer for children with Down syndrome to process verbal directions, it is beneficial to present new information in ways where the child can focus on performing the skill rather than the cognitive aspect of understanding the directions. Social stories are another example of a visual aid. A social story depicts appropriate behaviors or a sequence of an activity in the form of a story. Once a child sees a social story, they can later relate it to the real scenario. Visual aids can also reinforce routines and structure by illustrating schedules in a way that is interactive and lets the child be ready for what's next. It also helps with making transitions and keeping expectations clear. When a child can comprehend and have expectations about the activities that they're participating in, they will be less likely to present undesired behaviors, allowing for maximum learning to take place. Motivation is one of the most important components in fostering learning for children with Down syndrome, especially for those tasks requiring sustained physical participation. They thrive in environments that they are excited to be in and participate to their fullest when encouraged and rewarded. It is important to encourage improvements in efforts rather than performance and ability. If the child feels accomplished and motivated while learning a skill, the competency and ability will improve with time.
Yeah, ready?
Oh!
Oh! Bonk!
Hit it again! Go, go, go!
Hit it! Oh, off the head!
Now do
It is vital to provide the child with an experience that they enjoy. Otherwise, their desire to learn the new skill will vanish. Motivation techniques can include cheering, high-fiving, clapping, rewards, stickers, teacher involvement, peer mentors, and things that make the child happy and willing to participate.
Set, go! Run, 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 run! Woohoo! Good job! Awesome!
Finding out what the child is interested in and enjoys can help make motivation that much more easy. For example, finding out the child's favorite color and using bats and balls of that color, or finding a character that they really like and using wall targets that portray that character. Similar to motivation, consequences that strengthen a desired behavior help to foster learning. These consequences are not bad and are known as reinforcers. Reinforcers are used to provide the child with some type of validation that what they just did was good or correct. It is more beneficial to reinforce positive behaviors rather than provide negative reinforcement for challenging or incorrect behaviors in children with Down syndrome. Providing reinforcers like stickers, high fives, or other tangible objects will help encourage the child to perform correctly and practice a newly learned skill while staying engaged. If-then statements, or the PREMAC principle, encompasses pairing a desired activity with a not-so-desired activity. If the child you're working with has no desire to perform a certain task related to a skill, try pairing it with an activity that they really do enjoy.
If you throw 2 times and knock the pins down, we can go play with the balloon. Okay?
Did you hear her? How many times? 2 times. How many times? Hey, 2 times.
All right. Let's knock him down.
1.
Oh, that was a good throw.
That was a good throw.
Do you want to try with the carrot? Oh, Eliza.
How many was that?
You have 1 more. You need a good throw. Would you like the carrot or the push ball? All right, throw it really hard. Oh, nice throw.
Good job.
All right, we can go do 3 throws with the balloon.
Go get the balloon.
Go get it.
Providing the child with the opportunity to do something that they really enjoy can motivate them to do the desired task. When teaching children with Down syndrome new object control skills, it is important to limit the distractions within the environment. In order to maintain the child's attention, extra equipment and individuals should be limited. This also includes controlling noise levels and being aware of the various noise distractions within the environment you're working. While there are multiple techniques shown to be successful when teaching children with Down syndrome, learning is not likely to take place in an environment that is not structured, where the child is disengaged or learning is not rewarded. This is why it is vital to be proactive rather than reactive in regards to the behavior management of children with Down syndrome. Let's take a look at the 6 effective behavior management strategies one more time. The development of gross motor skills at an early age is paramount to the maintenance of a healthy and active lifestyle later in life. Once these skills have been acquired, children can begin using them in physical activity outside of school and in their everyday life. Development of object control skills offers individuals a set of basic gross motor skills to allow them to explore and participate in an array of physical activities and sports. Participation in recreational, leisure, and sport activities can improve quality of life, foster social interaction, help maintain a healthy weight, and provide enjoyment through being active. It is important to find resources to assist individuals with Down syndrome to contribute and participate with their families and in their communities. This includes maintaining a healthy and active lifestyle and successfully interacting with those around them. Ensuring that each individual receives a physical education that provides them the necessary gross motor development early in childhood is one component of achieving this goal.
In your opinion, what are the most important benefits that come from the development of object control skills at a young age for individuals with Down syndrome?
Developing gross motor skills in children with Down syndrome gives them the confidence and the confidence in their ability to perform those skills. So that leads to more participation with peers and to feel like they're participating in that activity and getting the most out of their participation to get those health enhancing benefits. the biggest thing to give them that confidence to be able to perform those skills means they'll be doing it more often with their peers and engaging in physical wellness as well as social wellness.
Sporting activities, whether it's like an adapted sports league or whether it's activities at the YMCA, a lot of them have to do with object control skills. A lot of basketball, hockey, soccer, baseball, so all of those, and all of the object control skills of catching, throwing, kicking, striking, all of the object control skills are very prevalent in like extracurricular activities.
What are the long-term impacts of these motor development delays on physical activity participation, including sport, for individuals with Down syndrome?
If a student with Down syndrome is not developing skills such as object control skills, they're less likely to perform them in game or skill type situations with their peers, so they won't perform them for a lifetime of physical activity.
Well, if children don't enjoy physical activity participation or don't have the opportunity to participate in physical activity, they can suffer secondary health effects like cardiovascular disease and obesity.
Well, students with Down syndrome have such low tone that typically they develop childhood obesity or their muscles, not even childhood obesity, just lifelong obesity. And if they're not active in things in school, outside of school, that's more likely to develop just because of the, just because they're not interested in being active or have the opportunities to be active or things like that.
Individuals with Down syndrome can participate at meaningful levels in team sports, individual sports, and physical activity in general. In addition, teaching fundamental motor skills can lead to acquiring and refining the more complex skills that are needed to play golf, tennis, volleyball, basketball, and so many other sport activities.